On this show, we'll dive into the complex realities of harm reduction, substance use disorder, homelessness, and related topics.
We want to emphasize that while we have extensive frontline experience in these areas, we are not accredited professionals. Therefore, despite thorough research, factual inaccuracies may occur from time to time.
We are passionate advocates who prioritize lived experiences and compassion in all discussions. Our conversations may contain explicit language and address topics that can be upsetting to some listeners.
We encourage everyone to engage with an open mind and understand that our goal is to foster understanding, empathy, and support for those impacted by these issues. You or Paul probably don't watch like a lot of
Mainstream.
sports
No.
or anything. So one thing that like I've noticed, because John Wick watches like ESPN, TSN, Sports
Oh, he's a
Center,
big
like,
sports boy.
oh yeah.
Okay.
Yeah. He made a we currently both on our fridge at home have a playoff bracket.
Oh, is he in like a lottery or
For-
whatever you call it for money?
No, we just do it for fun.
You do it too?
Well, only
that's
because
nice.
he put the sheet in front of me and said, fill this out.
Fair
and
enough.
I said, I don't know any of these teams well enough to like gauge who's going to win the Stanley Cup playoffs. But anyways, the one thing that blows my mind is that basically almost all the ads, or the only kind of ads they have, are gambling ads, like betting ads.
Really?
Yeah, it's like bet on this website, or bet on this app, or like there's like they'll do like, oh, this is the Bet360 check-in point, or I don't know what it's called, but like it's sponsored by Bet360, which are all like gambling websites. And they'll show stats on like who's likely to win at the start. They'll be like, let's see what Bet360 says who's likely to win this game tonight, and like
It's interesting how sometimes some of our issues that turn into addictions or turn into problems are actually government, not maybe funded, but government, like, yeah, go ahead, do that. Let's put this on the TV. It's constantly in your face.
Yeah.
I go back to the cigarette thing. I mean, they gave it to the soldiers during the war. They hurt their health. I mean, they gave them something. I mean, they're also possibly dead the next day, too. I mean, there's that aspect, so you can't really look at the health of it, but the thought that the government gave it to them? Like,
yeah.
anyway.
It's just like, it blows my mind sometimes, like when people think like, because I always go back to when I did that one presentation, and a woman stood up, and well, she didn't stand up, but she was like, basically I was just saying that substances are legal, some are illegal, and it has really nothing to do with their like health
or potency
risks or potencies or anything. Like they're like, we don't say, okay, we've made alcohol and nicotine legal because it's better for you, or there isn't that many, like as much health risk as it is like meth and cocaine.
No.
Right? So this one lady in my presentation, she stands up and she goes, I'm sorry, but are you telling me that like smoking heroin in the morning is just as efficient or just as comparable as drinking my coffee? And I was like, no, that's not the point.
No, that's not where you were trying to land.
No. Well, there's pros and cons to everything.
Absolutely.
Like risks and harms, benefits and harms to.
And that
everything.
doesn't even have to be a substance to have that scenario
No.
said at
No.
all. Many things are permissible, but not all are beneficial.
Gonna play
That's
our-
actually a verse out of the Bible. Did you
Oh,
know
is
that?
it?
Yeah.
I didn't know that, no.
Although things may be permissible, in other words, like it's not like you're getting, oh, you're going to hell because you did that. Permissible, but not all things are beneficial. And it makes sense. Like,
It makes sense, yeah.
even if you just look at coffee, if you ingest too much coffee, it has negative side effects and jitters and this and that.
Well, also too, like people assume when you say caffeine or coffee, people will say when you say like, oh, caffeine is addictive and it can be harmful.
Yeah.
People automatically assume coffee. But when you look at the caffeine intake on coffee and then compare it to what's the caffeine intake on like energy drinks
Oh my
or
gosh.
like caffeine pills or something, there's a big difference, right? So like, yeah, you could drink multiple cups of coffee a day and it probably won't, like, in the long term there might be health harms and health risks. I don't know enough about that to like deter
Yeah.
to say that, but like if you ingest 5 to 6 energy drinks a day,
Oh,
not
yeah.
only the caffeine though in energy drinks, like some of the energy drinks, like the sugar levels in it are like
Oh, but the chemicals.
through the roof, and the chemicals and things, right? So you ingest every day like 5 cans of like energy drinks. It's different than
That's brutal. I don't personally believe in energy drinks. Yeah, okay, you're having a
Believe
a
in
day.
them.
I don't. Well, another shopper story. Did I tell you that kids would come up to my counter with energy drinks, like other employees, but they were a lot
Yeah.
younger than me?
Yeah.
And one guy, he came to the counter with an energy drink, and I said, "Excuse me." I said, "Did your mom know you're drinking this?" And he looked at me and he's like, "What?" As if to say, like,
You're
my
such
mom's
a
not even here. I am such a mom. Anyhow, and I said, "Look," I said, "unless you tell me right now that your mom knows you're drinking these," I said, "I will not ring you in." He said, "What do you mean?" I said, "You and me right now, we're going to the cooler and we're going to go choose you something better."
Oh my
And I did.
God.
And he paid for it at my cash, but they're dangerous.
Do you remember when your kid, you would have been, your kids would remember this. You probably remember it as a mom.
Oh, for more than likely.
So I remember when Monsters became really big, and when I was in high school, like Monster energy drinks, and they had the multicolored tabs.
Yes.
And I remember we used to collect them. Like the goal was to collect them and wear them on a chain around your neck. I remember. Do you remember that?
I remember.
Did your kids do that?
I remember my friend's niece
Did it?
doing that,
Yeah.
and she would save the actual cans, and I'm
Oh,
pretty sure
okay.
she may still have them to this
I
day.
didn't drink. I never drank in them, but I would always find them. Like sometimes you find like, oh, I need the green one. I found it at the playground on the ground. But anyways, hi everyone. Welcome back to A Dose of Reality. I'm Cassandra.
I'm Tanya.
You happy to be here?
I am so happy to be here. And how about you?
I'm pretty happy to be here.
Well, I
So-
think today will be a fun day.
That is. So we're going to talk about harm reduction today. What is harm reduction? Where'd it come from? Why do we have it?
And if I could just throw it out there just from the very beginning, I love how Paul says harm reduction is just human decency.
Mm-hmm.
So you're reducing harms for people. I mean, I didn't see that funny, but I mean, it was cute.
The way I said, mm-hmm. So we have a few things, housekeeping things, before we get into the main topic today.
Oh, I'm so glad you're going to clear those up. I don't know what they are.
Well, we're going to start every episode with a check-in.
Oh, I forgot about that.
Yeah.
That's right.
Because we've already filmed this, but
Yeah,
it's fine. It's fine. The reality of it is,
We have so much fun when we do it, it doesn't matter anyway.
if you hear us moving, like for those listening, you might hear scratching or wheels moving. It's because our building is very old and slanted, and we're in wheelie chairs, and they
Constantly.
slide down constantly.
Slide to the left.
How have you been, Tanya? How have you been since we last filmed, recorded?
Yeah, that's a good question. That's a good question.
What has happened in your life? Do you remember?
Well, I got to see my grandson, and that's
Yes,
probably all
that's
I
good.
remember.
Yeah. I mean, if there's one thing to remember.
Oh, he's so freaking cute.
You went to he is very cute.
He is.
He is. You went to a school to give a presentation, but the kids wanted you to go and present to them about homelessness
And it was absolutely
because they're doing
fantastic.
a project on homelessness.
They are doing a project on homelessness. They're raising some awareness. They asked some really awesome questions as well. It wasn't necessarily like just topical. I mean, it was introductory, don't get me wrong, but they have a keen, what's the word I'm looking for? They want to
They're
learn.
eager.
They're eager. There we go.
Yeah.
And we sat down and we chatted. Conversation went really well, and they interviewed us because I brought Stephanie, our nurse practitioner, with us so that she could give more of a medical feel for what's going on and the seriousness too for our folks.
Yeah.
And it was pretty good. So smooth.
Kids are very eager. Students
Students,
are very eager. I've noticed that from the few times I've gone to schools, like whether it be universities or what have you, that they're very eager to learn and want to know kind of the serious issues that's going on.
Yeah, and it's cool that they reached out
Yeah.
to be able to do that because they want to learn more. And one of their questions was, how can we better support our community of homelessness? And to me, that's, I don't know if the word's epic, but it's awesome because that means that they're already generating kindness for people.
Yeah.
So that really impressed me. they were a wonderful group of kids. So,
That's awesome.
Yeah, it went really good.
Anything else in your life? Spent 2 days in the OPS.
I know, it was awesome.
Yeah.
I love working in the OPS because that gives me an opportunity to see people I haven't seen for a while
Yeah.
and catch up and like, hey, what's going on? Or just to be chill. And today it was kind of quiet, so it was a nice atmosphere for everybody. Everybody was super chill.
Isn't it so odd that like sometimes we think of going, for me anyway, sometimes I think going to the front line is almost like a breath of fresh air.
Yeah.
Like going to work I haven't done it in a while, but going to cover like the needle distribution or work in the OPS, I find like because it's so structured and you're there to do one thing and one thing only.
Yeah.
It's almost like mindless.
It's a break from
a break from paperwork. Yeah.
I hate paperwork.
And phone calls and like everything else. So it's nice. Like
it's socializing too.
Yeah.
Like, and it's part of our community is
it's how
part
we
of this-
learn for one.
Yeah, and it's so nice to see familiar faces
Yeah.
every day too. I love that part of it.
Yeah.
And you'll be covering a shift next week in OPS.
I will.
Well, for me, remember we
Oh
talked?
yes, I am. Yes, I am.
So you'll get to.
Well, because I also offered. He has some. Josue has some staff going out for training, so I also offered to cover if he needed it. So
Yeah.
I was yeah.
I hope I get to go down again too.
I know.
So Cassandra,
Yeah.
how have you been?
Okay. Okay.
Anything
Question
wild and
mark?
crazy?
I don't remember what day it is. I don't remember when we filmed last. I don't remember.
We
what
filmed
I've done.
last Monday, and we are Wednesday, but I had to think about it.
Thank
so
you.
You're
I know you
welcome.
really had a face on.
We're a team. We work together.
I'm.
How's your dog?
Oh, she's lovely. She's
Aw.
great.
See?
This is why people wanted to listen to this. If anyone's listening to this, this is why you're here.
To hear about your puppy.
My dog, yeah.
Yeah. Why do you think I'm here?
No, I went last week to do a naloxone training,
Mm-hmm.
and the organization was great. And it was interesting because they, not only did they have a lot of great questions, but also I'm going to assume manager, supervisor stepped forward and said, this is an organization that usually in the past, they had a strict abstinence-based mindset. So in order to access their services, you had to be abstinence-based,
Gotcha.
right? You had to go in and just quit cold turkey, and that was that.
Oof.
But they've kind of came around now, and they now know because they really deal with people with extreme mental illness. So
Awesome.
now they're kind of understanding there's a correlation between people who have mental illness and substance use disorder. So they're kind of more open to learning about how mental health affects substance use disorder and vice versa, and how it's all connected and things. So it was nice to see an organization that was so rooted in its ways
Yeah.
kind of become open-minded and understand that that's not the way they can work anymore, and they need to kind of change with the times.
Yeah.
So yeah.
And that's awesome to see that people are
Yeah.
stepping up and coming forward with with the new information that's put out, with learning about best practices, learning about what works, what doesn't, what's evidence-based. And I mean, there's such a hand in hand with mental health and substance use, so that's awesome. They're stepping up to the plate.
Yeah.
It does take time for changes.
Oh, for sure.
I mean, the world keeps changing in itself, so
Yeah.
yeah.
So
So I think you have a daily dose of excitement for us.
I do.
You do.
No, you do.
No, because I think we discussed that this
I
is
don't
your
think we
jam.
did.
I think so. Woof woof. Narking.
No, you're still the.
I thought maybe you would elaborate on my fun fact I found that you already knew today. Sucks you already knew it. Freak's sakes.
So we're gonna go on to a segment we are calling the Daily Dose.
Oh, okay.
Yes. This is
I was like, what?
to a segment we are calling the Daily Dose, and basically we're going to take turns every podcast, looking up interesting facts or news articles or misconceptions or what have you, and kind of share it with each other. Kind of like what's going on in the world right now. We have a main topic, but also what is going on in the world right now, and. These daily
diameter.
doses are supposed to be harm reduction, substance use, mental health, what have you focused. And Tanya goes, last time we tried to record, and she pulls out of her butt that Australia is bigger than the moon.
Now, Now, who
That's what
doesn't-
she threw at my face the other day.
But didn't it like wow you with like?
It wowed me that it wasn't what I thought you were gonna say.
I mean, at least it was a wow factor, so I'll just stop now. But I mean, wow, Australia is bigger than the
Why don't
moon.
you share your dog fact and then I can elaborate on it?
Oh, no, that's fun. See, so I looked up, I was trying to cheat and I just Googled it really quick. And I was trying to find a random fact about harm reduction. I
It
thought
can
maybe.
be a news article or something too.
Well, it can, but I didn't get that far mentally.
okay.
So I just went the easy street.
Yeah.
And it's like, I know that they use naloxone in hospitals. Like if somebody gets too much medication by accident or not even by accident, maybe the metabolize different and some other scenarios. But I found out today that it can be used on animals. And I'm sorry, but that was like, what? No way.
Don't apologize. Okay, for one, don't apologize. You didn't know that.
Okay, fair enough.
So that doesn't, just because I knew that already, doesn't mean that it's not valid because you didn't know that.
Well, fair enough. Fair
But
enough.
so Tanya ran it by me, even though she wasn't supposed to. You were supposed to keep it a secret until the episode. She said,
Really
"Did
not.
you know you can use naloxone on dogs?" And I said, "Yes, I do." And she goes, "Oh, damn."
I was see, I wanted to surprise you. I was so excited I knew something you didn't, but although I didn't know something you didn't, but anyhow, I do think it's amazing that they can be used on animals
They can.
as well.
Naloxone can. We could probably do an episode later on about naloxone, but it is the essentially the medication that helps block opiate receptors and can temporarily relieve an overdose, the effects of an opiate overdose. So you can use it on dogs. You can use it on babies.
That blew me away too.
You especially actually should use it on small children. Small children should not have opiates of any kind in their system. So if you come across a child who for some reason you believe is overdosing, you should for sure give them Narcan or naloxone. But the only population you wouldn't use it on is palliative care patients.
Which, after you explained the palliative care point, it did make sense. But just to back up too, with small children, we're not necessarily referring to small children or babies using product, or sorry,
No,
using
but they can get
substances.
into it accidentally.
But that's what
Yeah.
I wanted to throw out
Yeah.
there. That if they're around, they very well
They
could
have a
get
mom, a
it.
parent, or a relative or a sibling who's on, like, say, methadone, and methadone comes in a liquid form. They could think it's juice. Kids put everything in their mouths.
That's how they learn. That's how they explore the world.
But yeah, you
Yeah.
especially use it on kids. That's an amazing fun fact. You should, if you think your dog is overdosing, or your cat,
Well, I mean,
or your ferret, or your goldfish. That one I don't know.
yeah, keep
Keep that one, yeah.
But that's just incredible. So I mean, it feels even better too, knowing. And it doesn't feel better. I know it's safe for the people that we use, but it's just even more encouraging knowing that a baby or a young child, and it won't hurt them if it's
Yeah.
administered. So
Actually, if you call 911 for a suspected overdose on a small child and the paramedics show up, they will give the child twice the amount of naloxone they would give an adult first.
wow, I think
Yeah.
that's incredible information.
Yeah.
I mean, we're not going to be out there saving the
No.
babies, but
I've never had to Narcan a child.
Oh my God, I couldn't.
I don't know what I would do if I had
No.
to Narcan a child. But
Same.
I've never had to Narcan a dog either, but we do see a lot of puppies. There's a lot of street dogs, so.
We sure do.
All right, folks. The time has come.
Dun, dun.
Dun, dun, dun. So our main topic for today is an overview on harm reduction. So the history of harm reduction, how it started, what it really is, just what it is, just what harm reduction is. So do you want me to go first? Or
Yes,
do you
I
want
sure
to go
do.
first? Okay. So we kind of split up who was looking for what. I kind of looked into the philosophy.
Oh, I wasn't sure.
History, origins of harm reduction. So,
I'm looking forward to this.
are you looking forward to it?
I am.
I learned some things. Some things I didn't know.
That makes it even better.
Yeah, honestly, we're gonna be experts. So, harm reduction has its roots in various social and political movements throughout
Okay.
history. So, the notion of harm reduction emerged in response to the spread of infectious diseases and other health risks that were associated with substance use, particularly injection drug use.
Okay.
So back around the 1960s, 1970s, the United States saw the rise of the heroin epidemic. And public health professionals and activists came together and they were kind of like, we need to come up with pragmatic, evidence-based approaches to help address the health consequences that comes with substance use.
Okay.
So there was a group of them that came together, and they were kind of like, we need to figure something out because this is spreading rapidly and faster than we've ever seen before. And then that was kind of around the 60s, 70s, and then the 80s happened, and in the 80s, lots of stuff happened. So, well, it was around this time too that people started to realize realize the limitations that came with traditional abstinence-based programs and how they don't work for everyone, because they don't. Abstinence-based programs, they get their roots in religion, like the 12 steps, AA, those things. They were formed based off religious beliefs.
Right.
And when you have an individual who's lived through some sort of religious trauma, telling them, okay, well, in order for you to kind of get the help and support you need to go to this religious-based program. It doesn't really work. And then, like, a lot of people, you know, that's not kind of the route that works for them. They can't just do the abstinence-based route. And it works for some. And if it works for you and it works for people you know, that's incredible and that's amazing.
Absolutely.
But we need other approaches. And that's kind of what they were starting to realize. It's very limiting.
Yeah.
So in the 80s, harm reduction really started to gain traction because of HIV/AIDS.
Right.
We're rolling down.
I have lost my grip.
So it really did. It really started to gain traction when HIV and AIDS epidemic broke out. And this is when needle exchange programs started becoming a thing.
Okay.
They used to start as like little people like literally giving out harm reduction supplies like needles in shopping carts, just like pushing them around and giving them out. Yeah, like it was like people really tried to do everything they could to kind of stop. How do we help this population? Because it was at the time when professionals started to realize that the population most at risk for contracting this HIV/AIDS and everything, any other sexually transmitted diseases, was injection users.
Okay.
From the sharing of the needles. And I read a book. Oh, I can't remember what it's called. It's like Undoing Drugs, something.
Right.
I can't remember all the details, but there's a specific story she tells in it how in the back alley of this like local club, it was like a bricked back alley, and there was one brick that you could remove, and in that brick was one single syringe hidden behind that brick. So if you were an injection drug user, you knew about this spot, so you would go remove the brick, give yourself your fix, put the brick back and the syringe back, and leave, and they would reuse. So many people reshared this syringe, yeah.
Oh my heavens to Betsy, that's insane.
Because they had no other, like, there at the time, and I'll scroll down because I have this like facts. At the time, it was illegal to carry these supplies on you. You could only carry syringes for medical use.
That's wild.
Yeah.
First thing I think of, I apologize for interrupting.
No, go ahead.
First thing I think of is, as you know, I joke and say peddle Hep C. I used to do presentations at soup kitchens to tell people about the dangers of Hep C. And on that journey of educating folks, not only did I learn about Hep C and some other items that go along with it, but when you inject, and I think it's the second time or the third time that you use the needle, it barbs. So
second.
It is a second, okay. And it ends up ripping your veins and you get an infection just from that. So to think of those poor people that used and what kind of shape their arm would have been. And not to mention how many things were, I mean, that's a beauty of harm reduction when we give out the supplies is it's cutting down. So Hep C, HIV, like, that just mind blows me that it was one syringe behind a brick.
Yeah, that they had felt like that's the only way they could.
Oh,
and like this was also around the time when bleaching, like people would try to bleach to sterilize their equipment, they would use bleach.
Okay.
But that's not really, that's not effective or healthy, because then like there's a risk of injecting bleach into your body, right? So,
and it doesn't straighten your syringe out to keep it from barbing.
No. And that's the thing. It may sterilize it, but your syringe is still barbed.
Yeah.
Like it doesn't fix that. So needle exchange programs, like I said, they started becoming a thing. They were the earliest inventions of harm reduction, with an aim to reduce transmission of bloodborne diseases like HIV/AIDS. Amsterdam and Vancouver were two of the first, like up there with two of the first.
Get out.
Yeah.
Amsterdam too. Okay.
Yeah, two of the first with that part of the world is way more advanced than we are.
We do
So,
live in the armpit of the world.
Do you know methadone treatments, like methadone maintenance treatments, were introduced in the 60s?
What?
Yeah, so they were introduced in the 60s as another form of harm reduction.
Right on.
Which, for those who don't know, it involves providing opioid-agnostic medicine, so such as methadone, to individuals with opioid use disorder to help kind of reduce the withdrawal symptoms and the cravings that come with trying to cut back. So through the 80s and the 90s, needle exchange programs expanded locally, especially in regions heavily affected by HIV/AIDS, not only to prevent the spread of sexually transmitted or bloodborne infections, but to also provide opportunities of education and counseling and access to other healthcare services to a marginalized population, right?
Absolutely.
So, because that's another, like,
Crazy.
harm reduction is very community-based. It's very community-centered, and people kind of can't wrap their head around that. They don't understand, well, you're only helping this one population. You're supplying the junkies with syringes and what have you, but we provide education for the community. For one, it's helping stop the spread of these diseases in a community,
Which is
in the whole community.
preserving lives.
Yeah, and then we also provide a lot of education, right? So, like, you come into a site like Ensemble, into our NDS or OPS, we are constantly providing education on why you shouldn't reuse needles, why you shouldn't share pipes, why you should always use alcohol swabs, why you should use this as opposed to this, why you should do this instead of that.
And we have hand sanitizer up and around.
Yeah, like hand sanitizer and things, right? It's a public health issue. So, like, we're always constantly providing education. We have counselors on sites. We're connecting them to services. We have a nurse practitioner on site. We're connecting them to healthcare services. A lot, like, a core saying for harm reduction is meeting them where they're at.
Yeah.
And that's kind of what we do. We understand that we make it accessible. We understand that asking them to come to us all the time is not realistic or not appropriate. So we come to them where they need to be. All the services are kind of in one place where they need it to be.
And if they didn't come get clean harm reduction supplies and they just kept damaging the situation, if you will, I mean, they might not find out about different resources that could fulfill their life a little bit.
We've connected people to a lot of different resources.
Oh my goodness, yeah.
Yeah, so safe injection sites also started in the 80s. This was 80s was a really big boom for that's the thing. For those who can't see it, Tanya's making like a disbelief face right now.
Well,
harm reduction isn't new. Like, it's not a new concept. It's been around for the 80s were what? How many years ago?
40.
40 years ago.
You're not even 40 yet.
No, I'm not. So the 80s were 40 years ago. The 60s, 70s, like, that's like 50 years ago, right? So, like, these aren't new concepts that were suddenly coming out of the woodwork. And we're like, you know what we should try doing? Here's this weird little thing we've invented. Like,
wow, the 80s.
Yeah, the
safe
80s.
Consumption site.
Yeah.
I mean, I get the whole, like, harm reduction was around before and, you know, all that, you know, stopping the bloodborne diseases and stuff and just human compassion. But I didn't realize that consumption site, that means it took 40 years for a safe consumption or for a safe injection site to come to Moncton, New Brunswick. 40 years?
I mean, we are very small, Moncton, New Brunswick, but yes.
No, but holy
To the
crap.
East Coast, even. There's only 2.
Where's the other closest
There's one in Halifax.
Halifax, right. Sorry.
I'm pretty sure there's only 2 on the East Coast.
That's mind-blowing.
Right. So they've expanded since then. So we now have programs that, like, include anything that is aimed at reducing negative consequences for drug use. So, like, I already said opiate substitution therapy. We have drug testing, education campaigns, like, even, like, safer sex campaigns.
Oh my
We deal a
goodness,
lot
yeah.
with, like, individuals who partake in sex work.
Yeah.
So even providing condoms to them so that they're
Safe.
safe and healthy, right? So those are forms of harm reduction. It's been influenced by the broader social justice system and a human rights movement. So it's giving people back their autonomy, giving people back their individualism.
Nice one. Success.
When you think of, like, the war on drugs,
Yeah.
right? So the war on drugs, it was just focused on, we want this to stop. We want to stop the smuggling. We want to stop. We want to punish people for their behaviors. If you're going to partake in this behavior, you're going to be punished for it. There's no focus on the person. There's no moment to stop and be like, why is the person doing this? Why do they feel the need to do this?
Unfortunately, people
Right.
tend to forget and think it's just a choice of, well, I'm going to wear blue underwear today, not red. It's not that
And it's
simple.
not. And it's very, like, we're going to social justice. Like, it's very unfairly targeted, right? A lot of the laws and the punishments are very focused on marginalized communities.
Mm-hmm.
And it's just a continuous cycle of stigma and discrimination, right? Because realistically, if I go home in after work and my choice of relaxation was to smoke from a meth pipe, like take one or two hits off a meth pipe, and then I'm chilled out and I'm good to go, but I can wake up the next morning and go to my 9-to-5 job, I wouldn't be frowned down upon. But because the clients who access Ensemble, most of them are homeless, and they're on the street, they're frowned down upon.
And that's so good to point out, Cassandra, because yes, I do live under a rock. You guys will all figure that out shortly. Coming to work at Ensemble, I knew the majority of the clients would be homeless and using substances, but I did not realize how many folks, and I'm so glad they do come in. I didn't wow. I didn't realize, that was new, how many housed people use. So it's really important that you said that. You go home and you have a couple tokes of meth, and then let's clear this up. Cassandra does not, but if she was
I should have said that. I don't know.
and then there's functional folks that use substances.
Yeah. You saying that, actually, I was in the OPS a couple months ago, or like last month, I believe, and one of our regular clients looked at me jokingly. We get this joke a lot. They'll be like, do you want to come out with me? Want to have a hit off my pipe with me?
Sure.
Right? Sure. Why not? We get asked that a lot. And they don't mean it. It's more of like
it's a tease.
It's a tease.
Joke.
It's like, we know you won't, but like, do you want to come do this with me?
We have good relationships with our clients, so we can joke around.
We can joke around. And I was like, no, it's okay. I don't do that. And he's like, oh, you're better than that. And I was like, no, I'm not better than that. I just don't do that.
Yeah.
Right? And then I remember another regular client looked at me and was like, I've never heard anyone say it that way before. I'm not better than you because I don't smoke meth. I just don't do it. Everybody chooses different things, thinks different ways, chooses different coping skills, chooses different recreational fun. Exactly. Like, I have friends who smoke weed, and I don't personally. But, like, I don't frown down on them because they smoke weed and I don't. And they don't look any different at me because, like, I don't smoke weed, but they do.
Absolutely. And I mean, in a friendship like that, of whom you're referring to, most times, I mean, it wouldn't be something done in the daytime. Like, again, it's like
just a relaxation thing that you do.
In your own home. And there's nothing wrong with using here. There's nothing wrong with using at home. It's not a pick. It's just, it just gives you a different perspective of who uses, who doesn't use, why they use, why they don't use. Anyway, that was a big thing that I learned when I came to work here. And it was good that I did see that because honestly, it's not.
Because we do. A lot of, like, homelessness and substance use overlap a lot, but it doesn't overlap completely. It's not 100%.
No.
Not every single person who comes to Ensemble and who uses our overdose prevention site or who uses our needle distribution are homeless.
Yeah, that's a
and
big
we don't
thing.
just have people, like, I know throughout the year we'll get a number of parents who come to, like, get condoms because they're free here, and then, like, pamphlets on how to prevent sexually transmitted diseases because they're kids of the age where they're starting to, have sex and stuff.
That's great that parents have done that. Education.
Yeah, we've had, like, it's all about education, right? So
Yep. That's big. I mean, you catch them younger. I mean, people are going to have sex. Pretty sure that's true. People are going to try substances, drugs, drinking, weed. I mean, I would rather give my kid information first.
Yeah.
And have yourself educated first because it doesn't always go so well the other way.
I did the DARE program.
Yes.
And did your kids do this?
No,
Or did
you told me about
yeah,
it.
I did the DARE program. Basically, they have like a police officer come into your school, the 6th grade. I wasn't like high school.
When you
Like
have
at the age of where like, oh, I'm starting to go to parties and like be around these things.
understand it.
No, I'm 6. I'm what, 11? 11, 12, like 6th grade. I had, so this police officer comes in, and basically from what I remember, it's just a scare tactic. They just sit there and they're like, this is why you shouldn't do these things. These things are bad. You shouldn't do these things. And then I remember I had to sign like my name on a piece of paper on like an agreement to get a certificate that said like, I will never smoke or drink or do any drugs. Again, I'm 11. Like, I don't understand. Like, I just mentally do not understand that, like...
And what did you sign away? Like, did you even understand why you signed your name?
No, I just wanted the free t-shirt.
Well,
We
maybe...
got cool t-shirts with it. So.
Wow. Well, I mean, at least they did something. And maybe my kids did go through it, but they didn't come home and tell mama about it. But,
They didn't get any cool swag?
I
They
didn't
come
see
share?
any
Oh, man,
swag.
I got a nice shirt.
Probably sold it. No, I'm joking. Just joking, kids. Anyway, but I mean, at least again, it's about evolving to like that was a touch of harm reduction. It wasn't necessarily the right approach or age appropriate, maybe in my opinion, but at least they were doing something. But at least it's getting better because actually, is it really getting better? Are there any better programs in schools?
I have no idea.
We should look into that.
I
I'm
have
gonna
no
write
idea.
that down because.
But to me, it's more about
important.
providing the facts, not be like, don't do this because it's bad. Here's this thing. Here's what happens if you partake in this activity. Be smart about it. Like one thing I was very grateful about for my parents, like I remember when I was about 14, 15 and I started drinking for the first time illegally, right? We're talking about illegally taking substances. How many children go to high school parties? Anyways,
Yeah.
but I remember when I started doing that, my parents never said, no, don't do this. They never said, no, this is bad. You shouldn't be doing this. They never like frowned upon me if I like woke up hungover or came home drunk. They was always like, where are you going tonight? Oh, you're going to so-and-so's house? Okay, do you need anything? And they would buy me, I don't know if I should be saying this, but
Sorry, Mom.
but
sorry,
they would
Dad.
have rather like know where my alcohol comes from.
Yeah.
And they always told me like, when you were ready to come home, call us and we'll come pick you up.
That's beautiful.
Right? And then the next morning, I mean, there was like teasing. Like the next morning if I woke up like hungover or something, there would be teasing.
Yeah.
But it was never like, oh, I never got wrung out for it. I never got yelled at for it. Because it's a natural thing.
Yeah.
Right?
They knew you were going to do it anyway.
I was going to do it anyway. Right? It was going to happen anyway.
They practiced harm reduction.
Yeah.
They made sure you had safe consumption.
Yeah.
They made sure you were going to be home in your bed.
But
that
that's what we
night.
should be doing for like every substance.
Yeah.
Like I have not been in high school for 10 years, Tanya.
Bite me.
Not been in high school for like a few years, for 10 years now. So like I don't know what goes on in high school parties. I also grew up in a small town, so I don't know what goes on in like city high school parties. But from what I've heard, like cocaine and stuff, like they're pretty serious substances go around. I would rather my kid understand the risks and the benefits of what comes with that. Like you might feel like this for a while and this is going to feel good, but in the long term this is what could happen, or be careful because this might happen. And I would rather like equip them with a Narcan kit, make sure that they know they can call me if anything happens, rather than be like, if you do this, or like tell them not to do it and then be like, them keep it from me.
That's so dangerous.
Right? So I could be, I don't know, I could be in the minority, but like,
Kudos to your parents.
it was pretty cool. That's just one thing I always remembered, right? Is that I had that option.
If they had told you, Cassandra, you cannot do that,
Yeah.
it just seems to create, and I'm not trying to tell all the parents out there, go tell your kids to use
No, but we've all
whatever.
been
That's-
kids. We've all been teenagers. When you're told to
Yes.
do so, even as adults, when you're told not to do anything, you're like, well, now I want to do it even more.
It's just a human nature
Right?
thing. It
Right?
really is. And then you have children that are underdeveloped, still developing into
Yeah.
adults. They need to know the facts of what's going to take place.
Yeah.
They need to be educated. So
They
I
do.
think that's incredible.
Do you know some organizations that endorse harm reduction? Just
No.
for people to be like, it's It's those leftists. It's those hippies. It's
Okay.
those. So the World Health Organization,
The Who.
the WHO, WHO endorses harm reduction. United Nations Office on Drugs and Crime endorses harm reduction.
Thank goodness.
And UNAIDS, which I've never heard of UNAIDS, but it's capitalized.
AIDS.
Yep.
I've never heard tell of that either.
I'm gonna Google it. But they all endorse harm reduction, and I'm Googling. It's a joint United Nations program on HIV and AIDS. We could have got that. Joint United Nations UN.
United Nations AIDS. Look at us go. Yeah, good thing for Google.
Wow.
Yeah, wow.
But so yeah, and today some countries, they've integrated harm reduction policies into their drug policies, adapted more balanced approach, have combined different prevention and treatment and harm reduction measures. We have not, but some places have. So that's kind of just like the brief history on where it came from, how it started. It's been around for a long time. It started with 60s, 70s, 80s because of HIV, AIDS, and heroin. It's been around for a long time. I have a little story that's going to make you mad.
Oh.
It may
As long as it doesn't make me cry, I can handle anger.
No, it's not going to make you cry.
Okay.
So I read in this book once, and I really got to find the name of it. It's called Undoing Drugs. If we have a description, I'll put it in the description.
Oh, that's great.
Yeah. It was really interesting. I read it a while ago, so I can't remember fully the title. But I know they talked about this story about how I don't remember all the details, but they talked about the story how in, I believe, New York, maybe Manhattan, they talked about how these group of activists got arrested for handing out harm reduction supplies.
Really?
Yeah, so I had to Google it, and I couldn't really find any, Google didn't really know what I was talking about, and I couldn't really get the right words to Google that story, but I did find this this article from 2001. Oh. So this individual, James Rowe, he is identified in his lawsuit against New York City, was 21, homeless, and a heroin addict when he was searched and arrested in the West Village on a spring afternoon in 1999. He was carrying a syringe from a needle exchange program in the Lower East Side. He said he was also carrying a card showing that he was enrolled in the program in a storefront called Avenue C, and could lawfully carry syringes he picked up there, but the card was no help. So from my understanding is these harm reduction agencies used to give individuals cards to be permission to carry syringes for non-medical use. He said that card was no help. He was released the next morning. He said, I was starting to sweat and shake because I was way past my last fix. He left with 2 cigarettes and a court summons on a charge for criminal possession of an instrument, a medical instrument, so a syringe. And the card was supposed to protect him. The card that was supposed to protect him was gone. He said the officer he gave it to cut it up.
Cut it up?
Yeah. This is no shame. This is no shit talk on police officers, by the way.
No,
This is
absolutely
verbatim from the article. They get a kick out of it, the New York plaintiff said in a telephone interview from New Jersey, where he now lives. They said, quote, "You stupid junkie." He said, "I know I'm stupid for shooting dope, but they just like to watch you get sick." Yeah. And then it went on later to say as a heroin addict in California told interviewers let me try that again. As one heroin addict in California told interviewers for an academic study, "I would rather get AIDS than go to jail."
What?
So this individual would rather share needles and get AIDS than risk going to jail by carrying harm reduction supplies.
Oh.
So
There's so much wrong in that.
yeah. So at the time of the arrest in the 90s, needle exchange programs kind of existed in a gray area in some places in the States. So there was no federal law that explicitly stated you cannot run these programs.
Okay.
There was no real law that said
it's illegal.
it's illegal to have these programs. But many states and local jurisdictions had laws that made the distribution of syringe without a prescription illegal. So activists and public health advocates argued that the benefits of a needle exchange program, such as reducing the spread of HIV and AIDS, and other bloodborne diseases should outweigh the legal risks.
Yes.
So you should be allowed to hand out these syringes, but there were different laws that made it illegal to carry not only syringes but also naloxone kits, apparently.
What? Oh my goodness, you get stabbed with naloxone and nothing's gonna hurt you.
Yeah, so that was just a little story I found that was from New York Times, I think.
wow.
It was very long, so I cut out like bits and pieces of it.
Yeah.
But yeah, it was from the New York Times from 2001. So I just thought it was very disheartening, but also kind of very eye-opening that we've come this far. But then you have to think, well, look how far we haven't come.
It takes so long for change.
And we're still fighting so hard for different changes. And like, yeah, sure, we can hand out these supplies now and nothing, like, you can't get arrested for carrying these supplies on you.
No.
But that's kind of like the one step we've made, it feels like some days. There is still stigma around carrying the syringes, and it
Yeah.
definitely still gets confiscated in certain locations and certain places.
Yeah. We have come a long way, but we still have so far to go.
Yeah, it's one of those things where you're like, oh man, look how far we've come since that happened.
Yeah.
But, oh man, look how far we've only come since that happened.
We
It was
still
just
have a
kind of,
big
yeah,
fight.
there's still a big fight. So, that's kind of my coverage on the origins and the.
Yeah.
Hope that was interesting.
I thought it was wonderful, and I really
Yeah.
like the idea that you don't tell me what you do and I don't tell you what I do, because I'm like, wow, really?
Realistically, when it comes down to it, harm reduction just puts attention on the individual, right?
Keeping them safe.
We hand out these supplies, we hand out pipes, we hand out syringes, we have a safe space where people can come and use so they don't cause more harm to themselves. So they don't spread these sexually transmitted and bloodborne infections.
Yeah.
So they don't reuse needles.
There's just so much damage, and I mean, everybody's on a different journey.
Yeah.
We just need to meet folks where they're at and keep them safe.
Well, yeah, so that they're alive. Like, as morbid as it is and as hard as it is to hear and say sometimes, we do it so they're alive to eventually make that choice for themselves.
Yeah, and I mean, look at a seatbelt. It was years ago that nobody wore seatbelts. It wasn't law. You weren't even.
I was going to ask, but I didn't know. I didn't know if it would be offensive to say, do you remember that?
I lived that. No, I'm not offended, dear.
Did you really?
Oh my God, yeah. As a kid, I remember. Well, I don't remember, but Mom told me as an infant she just sat me on the seat next to her while her and Dad drove through the city.
So you would have remembered, like, I remember hearing that, like, there was protests and, like, uproar. Maybe not here in Canada, but, like...
I was too young to recall it.
Okay.
I think when the seatbelt law came in, if I remember correctly, it was when I was in elementary school. So I remember having to get used to wearing a seatbelt. It's law now. So, but I mean, think about the harm reducing. I mean, okay, there's also the controversy with people with seatbelts that if you don't have something to cut it, a seatbelt could kill your life too. But everybody's used to it now. But there were so many people that protested wearing a seatbelt that it could take your life. It's no different than sunscreen being.
It's the
this
pros and
that.
cons, right?
And what outweighs what?
Exactly.
What's keeping people safer so they can have longer lives?
Oh, exactly, and that's the argument with the seatbelt. If you take a seatbelt, for example, that's the argument. Yes, you could get trapped if you get in a crash.
Mm-hmm.
But that's less likely, not impossible, but that is
No.
probably less likely to happen as opposed to saving your life
Yeah.
from other crashes,
Well, we think of a fender bender. It does come in handy not to be
Yeah.
thrown out a window.
right? Because the G force will.
So it's this. I'm glad that we get to discuss it in these kind of ways too. Hopefully, it's interesting for everyone else. But when you stop and you talk about some of these situations, it just brings it to light. Like, a seatbelt's not the end of the world.
No.
It's actually helpful, and you can still choose not to wear a seatbelt. You may get a fine, but I don't know. It's just.
And what do you not like? This is kind of like what I put on people who are against it and who are against it and who have things to say or who are not as open-minded about the idea of harm reduction and what we do. Are you concerned because you're saying it's not safe for the community? Are you worried about safety, or are you just uncomfortable with what you're seeing?
That's big. Because if you don't have the understanding as to why you're doing what you're doing or why something that you're seeing is taking place,
Yeah.
And if you're not open-minded, yeah, it's a huge wall. And
Yeah.
that's what I like about this podcast, because it kind of like opens up some avenues to gain some understanding.
Yeah.
That it does make sense.
Yeah, exactly. Because like we get that a lot. People will say like, "Oh, our property is not safe. It's unsightly. There are needles around." Blah blah blah. Is it that, or are you just uncomfortable with the fact that you're seeing a really big issue brought to light?
Yeah. And there's ways to help.
Because
instead of-
ensemble's not the issue,
Gosh, no, we're keeping people alive.
right? Exactly. We're not the ones who are enabling or keeping it going, or just focused on the substance use. That's not us.
No.
It's gonna happen no matter if we're here or not. We could tear down this building tomorrow. We can all like be like, you know what? I can't do it anymore.
Yeah.
Let's get rid of the building. Let's just close her down. There's still gonna be substance use
Oh, there
and
is.
homelessness in this town. In any town, you make that decision.
And people would not be as safe. Where would they
No.
get their supplies? What would happen to the folks' lives? How many more overdoses would be taking people? We've lost too many as it is.
And then you come back with the people who say, well, it's their choice. They deserve it. You get those ones. And we don't get to play God, and we don't get to say who deserves what,
Oh, no, yeah.
right?
Yeah.
Because this person made choices or lived through experiences that you can't relate to or you don't understand. You're going to say that they don't just have a right to get better or get help. Like, I don't understand that.
How do you deny somebody that?
Yeah.
Just because people use, whether they're drinking wine all the time or whether they're smoking or drinking coffee, I don't care what you do. It's just, that's not the person. Like, they're so focused on labels and not demoralizing people, but degrading people to take away, oh, they don't deserve that. Everybody deserves good health care.
Yeah.
Everybody deserves to be housed,
Yeah.
to have a washroom to use when they need
It's not
the
something you're
washroom.
deserving of. It's literally a human right.
Exactly.
Right.
Oh,
So
that, yeah.
these
I might need a
conversations are going to get frustrating. We're going to get heated.
More than likely, I get my knickers twisted easily over this stuff
Yeah.
sometimes.
But it's necessary to talk about it. And the first few episodes are going to be heavy. They're going to be
yeah.
unloading trying to cover a lot of ground in a short amount of time. But as we progress, we'll dive deeper in a bit more topics.
Yeah. And we don't want to be overwhelming to folks either. We want to just unpack things. And
That's kind of the rundown of it. And we're still kind of getting the hang of it, how we're going to sign off and everything. But that's really what we wanted to share with everyone today is what is harm reduction? But like that's really what we wanted to share with everyone is an overview of harm reduction, because it's the foundation of what we are going to talk about. Everything we say from here on out is rooted in the policies and the practices and the approaches of harm reduction. So,
you did an amazing
Yeah.
job with
Oh, thank
the cool
you.
facts.
Thank you.
I learned
you.
today. I thank you very much. It is a very interesting topic.
It is. It is very interesting, and there's more to come. Sorry.
Indeed, there is more to come.
Uh.
I'd like to say that, not that it has to, like, for sure be this, but I think we should really unpack what an addiction is next segment. It's heavy, it's big, but we can Coles note it and make it palatable.
Yeah. So I guess that will be the next topic. What exactly is an addiction? And
I love reading what an addiction is, because when you read this, I'm not going to tell you all yet, next time, but it really lets you know that it's not necessarily, this choice factor that everybody thinks. There's more science, there's more to unpack with an addiction.
yeah. So I guess then if we're going off that, I think next episode, stay tuned, because I guess what we'll talk about is what is an addiction, how mental health and trauma are all related to any form of addiction.
Yeah.
Not just substance use disorder, but kind of how there's an interlinking, multifaceted, complex web between mental health, trauma, and
Substance use.
substance use / forming an addiction of some
Yeah, because
some kind.
it doesn't
So
have to just be substances people form addictions with
we have so
trauma.
many ideas that we're trying to like go slow as possible, but like we kind of want to dive into everything. So thanks everyone so much for listening to the first 2 episodes of our podcast.
Look at us go.
So, I mean, if you watched the pilot or listened to the pilot and then decided to keep going and you're still here,
Yes, thank you.
thank you. We're still working out at the time of recording this, we're still working out a release schedule, but I'm sure it's already been determined by future us's.
I feel like I'm watching The Flash. With
I
you or
know,
something.
I know.
Jump to the future.
So, yeah, thanks everyone so much for listening. We will be back next time where we talk about mental health trauma and what exactly is an addiction. Follow us on our Instagram and our TikTok.
That would be
Sometimes we
incredible.
post clips on the
You.
sometimes
dinosaur.
we post clips on our TikTok that don't necessarily make it into the podcast for could be audio reasons, could be just time length reasons, but funny behind the scenes content happens over there. So yeah, please make sure, thank you guys so much for listening. Make sure you follow our Instagram, our TikTok, send us a email if you have a question. Our email is also linked below. And yeah, thank you guys. We'll see you next time.